interestingly enough, we've made phenomenal progress on controlling subclinical mastitis. Like 30 years ago, 30 years ago, 35-40% of the cows in a herd routinely would have subclinical.
That high?
One or more. Yeah.
Oh my, yeah.
Today it's about 12%, but it's still the most common disease of dairy cattle. So somewhere between 12 and 15%, about 15% of the cows.
Are you? It's the most common disease. Now you're not going to make Jess McCart mad, are you? Because she's a ketosis person. Okay.
Ketosis occurs in like 2 weeks. Period. Mastitis occurs
Here
in
we
all
go.
cows.
Okay, shout out to Jess. Jess, of course, is our new.
Ketosis is actually way down the list. We did a study a couple years ago.
Oh, stop now! You're digging a hole, and
No,
I don't want you to dig a hole. Okay.
I'm not digging a hole.
You're trumping up the mastitis thing here.
Because it is the most common disease of dairy cattle, and
there's more. And what?
The only disease that actually affects the milk secretory cells, the cells that actually make the milk.
That's true, right? That's true. Yeah,
and damages them.
Hello, everybody, and welcome to the Dairy Digressions podcast. I am Matt Lucy, and I will be your host. We're recording today from the ADSA 47th Discover Conference focused on dairy, cow, and farm resilience. ADSA Discover Conferences bring together the top minds in the dairy industry because today, well, I forgot, Pam, I missed a few lines in the introduction, so we're going to do that now, okay? If you enjoy Dairy Digressions or have any feedback, and your name is not Pam Ruegg, please let us know at adsa@adsa.org. Make sure to like, subscribe, and rate us on whatever platform you're listening on, and spread the word to a friend or colleague. Now let's get to the podcast. Today, we have with us one of my favorite people of all times, always laughs at all my jokes, Dr. Pam Ruegg from Michigan State University. Pam and I are old friends. Pam is currently the David Ellis Professor of Large Animal Clinical Sciences at Michigan State University. Pam, welcome to the podcast.
Matt, I've been waiting and feeling so left out by not being on it before.
We save the best for the middle around here, okay? We save the best for the middle. Yeah, Pam and I know each other forever. We're gonna get to this. We think we were just reminiscing. We were just digressing because this is Dairy. We think we met in Brazil.
At a dairy conference.
We were working. We were working
at a dairy conference.
We were working, and we were on a beach. And
the beach and working don't go together. Don't let all the secrets out.
Right. And so I remember we were down in Brazil, and we were at a conference, and we were at the beach. Ilhabela, I think, was the name of the island. We were there, and my wife was there, and your husband, and your children, and we just had a great time. We hit it right off. Do you remember what my wife always says about you, about that trip?
Probably something related to cards.
No. Related to dogs, actually. Do you know the story?
Well, there were a lot of stray dogs around.
Yeah, and you know what you said when one walked up to my wife? You looked at it and said...
Rabies.
Yeah, a dog might have rabies.
Yes, I do.
She's like,
I do remember that, but it was good advice.
It was good advice. And I was thinking to myself, yep, we got a veterinarian on it thing. So anyways, we always start out these podcasts kind of learning a little bit about the people in the world. And we were talking earlier, and you said you grew up in the Upper Peninsula.
Yeah. Upper Peninsula, I'm a Yooper.
Just tell me what that means to be, first of all, for those people not familiar with American geography, because we have people all over the world who listen to this podcast. What do you mean by the Upper Peninsula?
So Michigan is composed of 2 peninsulas.
What, 2?
Yeah, there's 2 peninsulas.
Okay.
There's the one that looks like the mitten, where Detroit and Lansing and Grand Rapids are, and that's where everybody lives.
Okay.
And then there's God's country, which is above the lower peninsula. We call it the Upper Peninsula, or when we're talking about becoming a state, we call it the state of Superior.
What? Oh, give me a break. So it's actually that little piece that sort of juts out.
It's a huge piece that comes off of Wisconsin. So we're attached to Wisconsin, but we're part of Michigan.
That's strange.
And
do they count your votes up there, or do they get lost, or how does that work? There's not enough people to vote up there.
Yeah, people can vote, but there's not enough that it matters very much. Yeah.
No
And
presidential candidates visit here. Is that how that is?
It's mostly national forest. And
Really?
Yeah.
Oh, that's nice.
Yeah, it's mostly national forest, public lands. My great-grandparents moved up there. They
Wonderful.
were part of the people who cut down all the trees.
Okay, well, somebody had to do that. They're blocking the sun. We can't plant corn in tree stumps. Okay,
Well, you
they
couldn't
gotta
grow
go.
corn up there at that time.
Oh, it's too cold, huh?
Too cold. Yeah, the season's wasn't long enough till they had the newer varieties. Now they can grow a little bit corn.
That's
up there.
genetics, but
Yeah.
I know you're not a geneticist. Well, you sort of are. You're just a
I'm not a
microbial geneticist.
Yeah, there you
Okay,
go.
but we're going to get to that a little later. So you grew up in Upper Peninsula. My guess is there was 15 kids in your high school class, and right, you're valedictorian or something crazy
No, I
like
wasn't. But it's even more interesting than that. My high school is 50% Native American.
Oh, wow.
And
Okay.
so the Native American, the tribes up there, were never relocated. They
Okay.
are the original people who've lived there. And there's just the eastern end of the UP where I'm from is got a heavy Native American culture. The French settled that area. So I grew up in a kind of a really different environment compared to most people because of the Native American influence.
And did you always want to go to Michigan State? Did you always want to go in animal science?
I did. I always wanted to be a veterinarian.
Okay.
And working. And then when I was in my late teens, I started doing some veterinary experience with the nearest vet, which was about an hour drive from where I lived.
Great. Yeah, the horses and buggies are really slow. Okay, yeah, right.
And that area had dairy farms, and I started
nice.
going to dairy farms with the vet, and I just really found I really liked the whole system of, I like cows.
Yeah, you do, yeah.
I really like cows, but I also like the whole system of dairy farming. It's such a complex system.
Yeah.
And I really like complex problem solving. I like working with farmers, and I like working with cows.
It is true. It comes through in all your entire career, which we're going to go through. You seem like a person that hasn't been able to hold a job, but we won't get to that in a second. Okay. But when I listen to you give talks, not all the time, but it's not unusual for us to be speaking together at conferences, and your love for the science and your love for the kind of that. And I don't want to call you, your love for just being in there and doing it and solving problems just comes through.
It's interesting because often I'll be with non-farming people. And they'll ask, last weekend I was up in my hometown. And I was with some non-dairy people, and they were asking me something about, could you describe what it is, what you do?
Yeah.
And I started, and then I stopped, and I have to do this sometimes. I'll say, how interested are you actually? because if I get started in this, I can't stop talking about it.
Oh, you do. Yeah, you love that. You're just like, oh my gosh. So I forgot what I was going to ask. So we're going to have to go to the next question. Okay. I mean, oh my God, that is just terrible. You got your undergrad, and then you went to
I got my undergrad and my veterinary degree from Michigan State.
And were you an animal science major?
I was, and I was really involved in the dairy club.
Oh, no way.
And I milked cows at the dairy farm.
Oh, yeah. Now you have a new dairy.
And we will soon be moving into the new dairy that replaces the one that I actually milked cows in when I was in school.
Okay, so but you'll do your research there.
I do some research there. In fact, I've got a study right now I'm waiting to start because we're due to move. I just got the funding for it.
Oh, fantastic. Congratulations.
Thank you. We're due to move in, and I had planned to do it this fall, but there's no way you can start a study when we're moving and expanding. So I actually have just been working on delaying to my start date on a project to get into the new facility.
And we're going to talk about your science, but I know is it a mastitis project, just so I know?
It's a really cool project. It's so super secret, I really can't talk about it.
Okay, yeah. Like everything else. Okay, so we're going to go through very, 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 very quickly. So you were in private practice for a while. What town were you in private practice?
Practiced in Kiel, Wisconsin.
How long did it take before you killed your first cow? That's the question.
I have to think about that.
Because there's always a few tough days on the one you're starting, right? You don't start out being the expert.
So there were almost no women doing dairy at the time when I went in.
There's still there's more now.
But there were like none. And so I was an oddity going to these farms. And so there was a lot of skepticism on whether or not a woman could do that job. So
Yeah.
whenever anybody would ask me, and they did frequently, have you ever done this before?
Yeah.
I would always look at them, laugh, and say, no, is this the right way?
That's great.
And then they never knew if I was like telling the truth
right.
or just joking, and
Yeah.
it confused everything. And sometimes it was the first time.
Yeah. Well, I got a lot of good friends that are veterinarians, and I only joke about first days in veterinary practice with my friends, because I've it can be rough, right? You're getting hit with everything, and you're trying to figure some stuff out, and
oh, they were really careful with me in the practice that I went to work in because there had been no women in this area before.
Yeah.
So my first probably several months, they only or preferentially sent me to young single male farmers.
Okay.
They gave me a lot of leeway.
So you were in private practice, but something drew you out of private practice and back into academia. It couldn't have been the paycheck or something like that. I mean, why leave private practice?
I liked private practice, and for younger people that would be listening to this, when I got out of vet school, I absolutely knew what I would do. I was going to move to a small town in Wisconsin and be in private practice the rest of my career. I was going to have a little farm with some sheep and horses, and I absolutely knew that I would never be in academia, I would never be a professor, I would never do any research. And when I was getting out of vet school and people were talking about graduate study or residencies or whatever, I made fun of all of them. I was like, you guys are losers. You just can't deal with real life. I know exactly what I'm going to do.
Right, yeah.
And, so I get my job, I moved to Wisconsin, and here I am in academia, and they're all like in private practice, all those people who I made fun of.
Yeah.
And I think one of the things that has kind of driven my career to a certain extent is I've been willing to look for new opportunities to learn more.
Right.
And I've been willing to take the risks that go with that. And so because of that, I've had a lot of different jobs. I've learned a lot of things, but it's also been wildly rewarding because I'm always kind of doing something different with my career.
It's interesting, particularly early in your career. You must have been moving around a lot.
Yeah, it was hard too, yeah.
Because you went to Davis, and I think that it sounds like that was a residency.
It was a residency MPVM. It was a combined
What's
program.
PVM? Don't use the words like PBM, peanut butter and, I don't know, mayonnaise.
UC Davis has a very unique degree. It's called the Masters of Preventive Veterinary Medicine. It's a post-veterinary degree.
What?
Yeah, it's an epidemiology degree.
So you have that degree as well.
Yeah, I do. But I'll just come back to kind of how I landed out there. I started in veterinary practice in 1984. My salary was $20,000 per year. And
that's not very much per week.
I got every third weekend off.
Nice, yeah.
And I had a 3-person emergency rotation. We were always called out when we were on emergency duty back in those days.
Yeah.
And I was in a nice practice. I was with people who were supportive of me, and I could have probably stayed there forever. It's been a successful practice. I started during I don't know if you remember 1984, that was the farm crisis. That was when the support price for milk dropped below the price of production.
Right, yeah.
And that was when Willie Nelson was doing all those
Farm Aid concerts
cool. And everything.
Yeah.
And it was devastating to the small dairies that I was working with in northeast Wisconsin.
Yeah.
And we had farms, with a lot of mental health crises, and there were no supports there. We had farms that, just were devastated by the fact they couldn't make enough money. And so it was the beginning of the restructuring of our industry. So I was, working with farmers who were going through a lot of stuff. During that period, I decided I really wanted to remain in dairy. I was enjoying it. And I wanted to learn more about large herds because I felt like if I was going to do a whole career in dairy, I needed to be able to manage large herds. We didn't have very many. We had this was Wisconsin in the 80s. We had one 500 cow dairy that we did work for. So remember, I was making $20,000. I got 2 weeks of vacation, and I was on emergency all the time. It was winter, and I opened the veterinary magazine, and they were listing educational opportunities, and one was at UC Davis. It was a 3-year program, combined residency, clinical training, and this graduate program where you have a whole year where you're out of clinics, where you're doing classes straight for a year.
Yeah.
In epidemiology, which was my interest. And I'm reading it. I'm just looking at it. It's like minus 25.
Right.
Okay.
In Wisconsin.
In Wisconsin.
Right. The Packers just lost.
Yeah, the Packers just lost. We had snow everywhere.
Right.
I'm getting called out in the middle of the night when it's like minus 50 to go pull calves.
Right.
And I'm reading this job ad, and it paid $24,000.
Oh, wow. Okay.
Had 4 weeks of vacation and had full benefits. I had to pay all my own insurance and everything. And I look at this ad and I think, am I an idiot or what? Okay.
I'm doing this.
I had never been west of the Mississippi. I'm a small town.
Right. I could see this UP thing. Yeah.
And so I'm like, well, that'd be exciting.
Yeah.
I could learn about the big herds and I'd get paid more. And I applied for one residency.
I can just picture this. Okay, so now I have this residency in California. You pack up the station wagon with all your junk. Okay.
Well, I got married.
You got married?
Yeah.
So one of those farmers worked out. Okay.
It did.
Okay, there we go.
Yeah, one of my farmer's sons. I married one of my farmer's sons.
Awesome.
And the day after we got married, we packed up in the car and drove west.
I could just see you like, wow, it's not home.
So we were out there for 3 years.
And then you go back to Atlantic Veterinary College.
Yeah.
You're not smart enough to stay there. You're on the ocean. You're 30. You're 5 minutes from the ocean, and you don't spend the rest of your career at the Atlantic Veterinary College. And shout out to Katie Proudfoot of the Atlantic Veterinary College, Prince Edward Island. Shout out to Katie. Why did you leave, Pam? Explain yourself.
I loved Atlantic Veterinary College.
Okay.
I loved living in Charlottetown, Prince Edward Island. So I got recruited by Michigan State, and I reluctantly left there. I have very fond memories of that.
So you were at Michigan State for a while, but I'm really interested in your Monsanto move.
Yeah.
Good God, we're going to have another podcast with all, we can't get through all your moves, but I want to hear about your Monsanto days.
So I went to getting to Monsanto is interesting. I went back to Michigan State in an extension faculty position. And I felt really isolated from farms when I got back there.
Why?
I did at that time in the role I was in.
What were you doing in extension if you got
I was
isolated?
actually the director of veterinary extension for the college.
You were like an administrator
for the
person?
college. No, I was doing stuff. I started the Miracle of Life birthing exhibit at the Michigan State Fair.
I did not know there was a Miracle of Birthing exhibit at the Michigan State. Is that where you get the cows and you put them under glass and everybody stands there?
No, they're standing around.
You have them on a rotary? How does it work?
No, we had them in a big circular pen.
A big circular pen.
This was at the State Fair birthing exhibit. So the first cow goes in to calve in there, and the feet come out, and they're huge.
Yeah.
And
call the veterinarian fast.
And the first lady of Michigan was there to watch the first birth.
Oh, no.
And I look at these feet and I realize, well, we got to catch that animal. I got to examine her. And the first lady's coming. There's hundreds of people surrounding it. And I look and I'm like, I have designed a round pen.
This is not going to work.
How am I going to catch this cow?
This seemed like a good idea.
I'm not going to go into details. It all worked out fine. But there's a picture of me with the first lady next to the calf later, and it is not my finest moment.
I think that's great. It's your Monsanto days, and how many years were you with Monsanto?
I was with Monsanto almost 5 years. I started...
That's pretty long for you, 5 years. Wow.
I started the day the product was launched.
Oh, 1994.
On the day it was launched.
You started.
Yeah, and then I ended this September 1st of 98. So I started in like January and ended in...
Was that before allocation or during allocation?
We had some allocation. I went through the whole ride. Okay.
Yeah. So anyways, not everybody knows what we're talking about, but this is bovine somatotrope, and I'm an ex-Monsanto guy, but I was a postdoc in St. Louis, so I was working on the research end. Pam was part of the...
Tech service.
Tech service. And the BST era, it was exciting. It was fascinating.
Really exciting.
It was science.
It was.
It was something. Anything you want to say about that part of your career?
I learned so much in that period. So, I was in tech service at a time when we were introducing this new product, which was probably the most controversial product ever introduced in our industry.
Fair enough.
We had farmers who were very enthusiastic about the product. I think both you and I will agree the product does what it's supposed to do.
Yeah, it definitely works.
But nobody knew if there were going to be terrible side effects, even though it had gone through FDA approval, it had gone through all the approvals, and people felt it was okay. It was the largest, I think, probably product introduction as far as adoption of any product in our lifetime. I mean, we went from nobody using BST to like hundreds and hundreds and thousands or a million cows using it in like a year-long.
It's unbelievable.
Unbelievable
Right.
introduction. And there was this huge degree of anxiety of if people were going to stop drinking milk.
Yes.
And it was interesting. There were all the consumer people in Monsanto looking at that. And I can remember them reporting, oh, milk sales are up. It
Yes.
appears that people are just hearing all this news about milk and they're thinking, oh, I need milk.
That's great. I go, oh, that reminds me, I'm out of milk.
And then
That is a great story.
The farmers were, like my job, especially for the first couple of years, and there were very few of us in tech service, maybe 4 to 5 of us for the whole United States.
No way, only 4?
I was going to farms all the time. I had a lot of luxury relative to spending time analyzing records, and I tell you, I learned how to apply all the epidemiology I learned out at UC Davis to solve herd problems, and I learned a lot.
The dairy industry, I'm trying to think, that launched in 1994.
Yeah.
Goodness gracious, what is that, 20 years ago now?
Yeah.
And of course, since then, it's not widely used, I don't think,
It's
in America.
not marketed in the U.S.
Not marketed in the United States, at least. And so, but the industry has consolidated considerably, even since 94, I would say.
The industry's unbelievable. You know, I was looking at some stats on just, if you look at milk quality, if you look across herd sizes, across all the herd size categories, the only herd size that has increased in number of herds is herds greater than 2,500 cows.
Yeah, for sure, right?
So that means the 1,000 cow dairies aren't increasing in, the numbers of 1,000 cow herds. It's the number of 2,500 plus herds. And the thing that's been really interesting for me, I started on 50, 60 cow tie stall dairies in Wisconsin. All of that transformation of our industries happened in my career.
I think, just so our listeners know, we had the same experience. When you go from 60 cow dairies and walk onto a 1,000 cow dairy or a 10,000 cow dairy, you immediately, I remember my reaction was, everything I know is not going to work here. I need to, something else has got to happen. Because this is not, we're not managing one cow.
No, you're not. You're managing groups and you're managing processes. Now, like when, working with udder health and antimicrobial usage in my job right now, what we need to do is make things simple.
Right.
They have to be very simple, and everything's got to be preventive, because the individual losses of having a sick cow or a cow that's chronic, you just don't, in a giant population of 10,000 cows, you don't have the time to afford to spend on that animal.
And I think one of the things, Pam, and maybe you can reflect on this, and I think our listeners should understand this, is despite the fact, I don't know if despite is the right word, but we've gone from a lot of small dairies to fewer large, we have I don't know what the total number of farms in America is.
It's 24,000.
With a lot of cows. The total number of population not changed, but milk quality has gotten much better in America.
Yeah, milk quality has gotten really better.
Explain what milk quality is, because I know that's what you're interested in and why it's important.
Well, there's 2 things that go into the milk. Well, there's a bunch of things that go into milk quality. I mean, if you're in a developing country somewhere, you're interested in bacteriological quality, but we've mastered all of that. In the U.S., what we're looking at, we're already producing milk that is fresh. You got a big dairy that's shipping tanker loads. That milk is fresh. It's got extraordinarily low bacterial counts, and it's residue free because it's tested.
Right.
And so that's the fundamentals of milk quality. Is safe, highly nutritious, fresh milk. And then, of course, the somatic cell count, which measures the amount of subclinical mastitis in a herd, that has declined dramatically. In our
somatic cell
count
tremendously.
Yeah, so in about 20 years ago, on average, in the top 10 dairy producing states, it was between 300,000 and 400,000.
Wow.
And today, on most states, it's like Michigan. It's typically around 140,000, but you're well under 200,000 in our top dairy states now.
And that's an indicator of quality. A pathogen. I don't know if pathogen free is the right word.
It's an indication that you've got fewer udders infected with subclinical mastitis. So mastitis is an intramammary infection of the udder. It presents in 2 forms. depending on the magnitude of the inflammatory response, which is the cow's immune response to infection. If you have some pathogens that stimulate kind of a mild immune response, what you get is an influx of neutrophils, the white blood cells, into the mammary gland, but the milk looks normal and can be sold, and we call that subclinical mastitis. So it's less quality milk. It's not as good for making cheese. It's not as good for processing. It doesn't have as long shelf life, but after pasteurizing, it's perfectly safe, and they clarify it and remove those cells. That's subclinical mastitis. And then if you have a larger inflammatory response, you get abnormal milk in a swollen gland, or in a very small fraction, you get a sick cow. And that milk has to be discarded. Interestingly enough, we've made phenomenal progress on controlling subclinical mastitis. Like 30 years ago, 30 years ago, 35-40% of the cows in a herd routinely would have subclinical.
That high?
One or more. Yeah.
Oh my, yeah.
Today it's about 12%, but it's still the most common disease of dairy cattle. So somewhere between 12 and 15%, about 15% of the cows.
Are you? It's the most common disease. Now, you're not going to make Jess McCart mad, are you? Because she's a ketosis person, okay?
Ketosis occurs in like 2 weeks, period. Mastitis occurs
Here we
in all
go.
cows.
Okay, shout out to Jess. Jess, of course, is our new...
Ketosis is actually way down the list. We did a study a couple years ago.
Oh, stop now. You're digging a hole, and
No,
I don't want you to dig a hole, okay?
I'm not digging a hole.
You're trumping up the mastitis thing here.
Because it is the most common disease of dairy cattle. And
there's more. And what?
The only disease that actually affects the milk secretory cells, the cells that actually make the milk.
That's true, right? That's true. Yeah,
and damages them.
Here we go. Okay, so now you've made Fricky mad because you didn't even bring up the repro, okay?
They got that all worked out. You guys have figured that all out.
we think I was pregnant. So anyway, so first of all, we're going to have to digress for just a second. Big shout out to Jess McCart, our editor-in-chief. She's from Cornell, our editor-in-chief.
And even though she's from Cornell, she's awesome.
She's awesome, right? Editor-in-chief of JDS Communications, former section editor of JDS, the Journal of Dairy Science, as you are. We haven't had a chance to talk about that.
Yeah.
Those are our journals, and we're so proud of them. Are you still publishing in those journals?
Yeah, of course I'm still publishing in those
Are
journals.
you a member of the author loyalty program?
Yes, I am. In fact, I have to get up tonight and finish a review so I get my author. It's due today, and I won't get my points if I don't get it in.
Oh, so we have this new thing. We call it the author loyalty program. It's developed by my good friend Paul Koninoff from University of Nebraska-Lincoln. He's editor-in-chief of JDS, and you get points for reviewing.
If you get them in on time.
If you get them in on time. And you get points for something else, too.
For publishing.
Right, for publishing.
Yeah.
But anyway, so you were at Wisconsin. So we went from Monsanto, and I won't ask you too much about Wisconsin other than, again, a shout out to Paul Fricky, who was basically on the same floor.
I loved my job at Wisconsin. I loved being in the dairy science department. I loved the mix of my job. I was research and extension. I got to work with all the great dairy farmers in Wisconsin and veterinarians. That was an awesome, awesome, awesome job.
And that's where I knew most of the time I knew you. And then of course you moved on to Michigan State. That's kind of like going home, and that's always a dream. And I know you're in the animal science department for a very short time, but you were chair there for a few years. But I think you finally hit on your dream situation with this basically endowed professorship in the College of Veterinary Medicine.
It's a pretty awesome job, really.
It's awesome, And so, we have this joke between Pam and I when she was in animal science. You said, well, I said, you have a lab? He says, yeah, I got a micro lab. Which they gave you a closet to keep you happy.
I did. Yeah.
But you couldn't stop, and then you ended up over in the College of Veterinary Medicine, continuing in your research in mastitis, but now as an endowed chair. So congratulations to you.
Thank you. It's a really good fit for me. My responsibilities are research and outreach. And that's what I really
you do
doing.
some outreach.
I do a ton of outreach. Have you not seen my YouTube channel?
No, you and your YouTube channel. No.
550,000 views of my videos.
So you're a mastitis researcher. What are you focusing on for the people and the dairymen of Michigan? What is the focus?
And when I say it's not just Michigan, but it's the other states with thriving dairy industries. The big thing that we're working on is antimicrobial usage, antibiotic usage.
What?
Yeah, making sure we're right sizing that for farms. The number one reason antibiotics are used on dairy farms is for treatment and control of mastitis. It accounts for about 70% of the doses used on dairy farms.
Mastitis or dry cow treatment?
Dry cow treatment is part of mastitis control program.
Are you a selective dry cow treater, or are you a treat everything dry cow treater?
Herds that can successfully implement selective dry cow therapy should do it.
Describe that for our listeners. Selective dry cow
Selective
therapy.
dry cow therapy would be when you select animals that have likely intramammary infections that dry off and use antibiotics to treat those.
Okay.
And then to prevent infections, you use some sort of sealant, internal or external.
Right, okay.
And then blanket dry cow therapy is when you give dry cow therapy to every quarter of every cow at dry off.
Yeah.
Which, by the way, doesn't mean that every cow in a dairy herd gets antibiotics.
What do you mean?
About 35% of a herd is in first lactation.
Okay.
Okay? Animals don't get antibiotics till they dry off.
Oh,
and
yeah.
In a large proportion, somewhere between 30 and 40% of the herd never dry off. They select new careers.
Oh, yeah.
Okay?
Yeah,
Those
yeah.
animals become beef animals.
Right.
There's two career choices for a dairy cow. You
one
can
or the
produce
other.
milk, you can produce meat.
But
They're both good careers.
So what we're talking about is antibiotic treatment of cows. So cows get sick, people get sick. When an animal gets sick, we want to make it better. And one of the things that happens, and it is, I was teasing him, but I'm just paraphrasing for our listeners, is they can get mastitis, which is an infection of the mammary gland.
Yeah.
Used to be, didn't matter what the heck, it was going to get a tube.
Right.
And you taught me, well, I'm sure it was partly your research and your extension, that some animals, they don't need a tube, just leave them alone, they'll get better. It depends on the pathogen, right?
It does. And so what we detect with mastitis, with clinical mastitis, is we see the results of the inflammatory response, which are part of the immune system. And the immune system is often successful. So if we take milk samples from cows that have visible clinical mastitis, abnormal milk in a swollen quarter, if we take a milk sample from those cows, somewhere between 30 and 50% of those milk samples, nothing grows.
Oh.
Okay, so we got culture negative milk samples from a clinical case, which it turns out to be a fabulous prognostic indicator. The vast majority of those culture negative samples are true negatives. What we've done is detected the inflammatory response after it's been successful.
Now that's important.
Yeah, and so those animals don't benefit from antibiotics. How do we know they don't benefit from antibiotics?
You treated them and you found that they...
We did a clinical trial treating and not treating culture negative cases and showed no difference.
Oh, that's so interesting. So they're culture negative because their own immune system has killed all the bugs.
That's true for clinical cases that are culture negative. It's not true for subclinical cases, meaning they have a high somatic cell count.
Yeah.
Chronic subclinical case, if you take milk samples from them and you culture them, about 50% of those will be culture negative, but it's for a different reason. Those are false negatives.
What bug is that?
There's so many neutrophils present in the gland. The purpose of that white blood cell response is to engulf and destroy bacteria. Right?
Yeah.
And so if you've got 9 million neutrophils per ml of milk, you don't have very many bacteria there, and it's often below our detection limit.
Okay,
so a chronic subclinical case that's got a lot of neutrophils, that's a bad prognostic sign, meaning that you've got ongoing stimulation, meaning you must have an intramammary infection there, but it's not a successful inflammation. So the interpretation of these culture negative cases is different depending on the presentation.
First of all, let's just tell our listeners that they need to understand that if we treat a cow with antibiotics, we cannot sell the milk until those antibiotics are no longer present in the milk. And so
let me just add to that.
What? There's more to it?
It is, Matt. You're about my age. How much did cows produce in 1980?
Per day, 50, 60 pounds.
I looked it up, USDA stats, 50 pounds per cow per day.
Yes.
What's the average cow that gets mastitis produced today?
I don't know, 50, 60 pounds. I don't know.
100 pounds.
100 pounds.
I mean, cows produce 100 pounds on most farms today.
They do. It's true.
So If you use the exact same, remember we got to throw away the milk.
Yeah.
When the milk is abnormal, it's got to be thrown away, and when we treat them, we have to throw the milk away while they're receiving an antibiotic, and then for a withholding period for the antibiotic to clear.
Right.
So, if you've got a 3-day treatment and a 3-day milk discard, that's 6 days you're discarding milk.
Right, yeah.
If you're treating a 50-pound cow back in 1984, that's 50 times 6, 300 pounds. Mm-hmm. If you're treating a 100-pound cow today, you're throwing away twice as much milk.
Yeah, yeah.
Which means the same treatment protocol today is about 80% more expensive, which means it's not only beneficial to society to make sure we're only using antibiotics on cows that'll actually benefit.
Right.
It's economically advantageous to the farmer to make sure they're only using antibiotics for the right duration on the right cows.
So, and I think this is important, people understand that when Pam gives a talk, people really listen because there's significant economic implications for these decisions about whether to treat or not treat. There's economic implications on the farm, just as you correctly described there. The other things are we have antibiotic resistance on farms. It's not, and please, we've made the point before that please don't blame antibiotic resistance in human hospitals to antibiotic use on dairies.
Yeah.
It's not, I don't think we've ever confirmed that.
We haven't.
So that's a different thing. Mm-hmm. But as an industry, it just makes a lot of sense economically to reduce the amount of antibiotics used, but also it's good for the industry.
It's environmentally and socially responsible.
Yeah.
And that's a lot of what I work with. So we want to treat the cows with antibiotics that require it to improve their benefit and that will be economically beneficial to the farms. But we also want to identify the minimal amount of antibiotics we need to use on farms to maintain welfare and economic health of the farm. And that's a lot of what I work on.
Yeah, and it's important. And I know I was teasing about the diseases, but I've always recognized that mastitis, you lose a lot of money when there's a case of mastitis.
It's also like just the best disease. I mean, really.
It's also the best disease. Okay, here we go. Okay, too serious. Yeah. So so I want to talk to you a little bit about, and not to shortchange your science nor your extension program, because that wouldn't be fair. But I did want to talk to you a little bit about your service to the American Dairy Science Association. Before I do that, I just want to remind everybody that we have a meeting coming up this summer, and it's this June, a 10 to 2026 annual meeting, and usually the abstracts come out in the fall. A call for abstracts and due date sometime in winter, early spring. And there's a couple things about your career that's been interesting. I don't know how you did it all, but when I was editor-in-chief, did I ask you to be a section? Why? What was the deal? I mean, why did you say yes? I mean, okay.
I was section editor for, a term and a half. And then you convinced me to come over to JDSC when it started.
So tell me about, so that's an aspect of your world. I mean, it sounds like your appointment is research and extension. Mm-hmm. You don't have any clinical appointment then? Not
now. I have had other jobs where I had clinical appointments.
But this is kind of the service element of it.
Yeah, it is.
And so our universities, I don't know, I think many of us have a percentage time we're supposed to spend in service, and some actually do some service, and you'd be one that did a lot of service.
I have done quite a bit of service, yeah.
Tell us why. Why do you spend the hours as a section editor? A section editor is responsible for managing the reviews of hundreds of papers annually.
I think you just convinced me.
I did?
I have this very strong sense of obligation for a couple of reasons. One, I've been really fortunate in my career to be able to, do things I like to do, enjoy it. I've been healthy, and I've had a lot of people who've helped me along the ways. I'm at the upper end of women, meaning that there weren't too many women who went before me. And so a lot of the times I felt like when people have offered me the opportunity to be in leadership roles or service roles, that I should do that because it sets an example for the young women coming behind me. That's part of it. And then on the reviewing end, the other thing is, as an editor, you're the one who sends the acceptance letters, and the rejection letters, your name is on it. And you really have to be at a certain stage of your career to be able to live with that to a certain extent. There's people who get angry at you about that. And you also have to have a certain maturity on when it is acceptable to reject a paper and how it feels. You know, we have all had papers rejected. It feels terrible. So I felt like I was at the right stage of my career. I also like reading other people's research. So, you know, I'm talking about the things that I'm putting into it, but there is an advantage to it too. You get to read everybody's research before everybody else does. And I really like that. I like to see what's going on. My secret superpower is I actually read really fast.
Oh, I didn't. Okay, that is helpful, right?
It's a really helpful thing
Yeah.
when you're reviewing things.
Right. Yeah.
And so it aligned with my superpower and my interests and allowed me to give back in a way that was I think a good fit for my strengths.
And you're gonna be stepping down.
I'm out. I'm in January 1. Yeah, I'm no longer accepting or rejecting anyone's papers.
Is that right?
Yeah.
I always I felt the same way about work as a section editor and then editor in chief. It's a lot of hard work. We make a lot of people happy too, right? When their papers get accepted, very happy, right?
It's funny. I like on a Friday if I had some reviews come back because you have to wait for the reviews to come back to make the decision.
Yeah.
And on Friday I would send out acceptance, but if I got one that was going to get rejected, I would not send it on a Friday. No, because I just don't want to ruin people's weekend.
We don't want to do that. I think you would agree, Pam. What's really fun about the work, and again, we're corresponding when you're a section editor, you're corresponding with authors globally.
Yeah.
And you're inviting reviewers globally. It just kind of keeps you connected with the dairy science community globally. They know who you are. They know why you're asking.
Yep.
You know, and I just sent out some invites the other day, and you know, even sometimes like there'll be a student who you know just graduated with their PhD, and you send them, and they're so excited to get a note and say, "Hey, you send a note, say congratulations.
Yeah.
How would you like to review this paper?" And they're really kind of excited, about that. And the other thing I think is kind of exciting is you're going to be one of our 2025 class of the Fellow of the American Dairy Science Association. So congratulations.
Thank you. I was shocked on that.
What's that award mean to you? What is a fellow in your mind, or what do you think that means in your mind?
Well, somebody was asking me, somebody who doesn't know anything about dairy, I'd mentioned that I was getting this award. Actually, one of my sons. And I said, well, it's hard to describe, but it's kind of like a Lifetime Achievement Award. Yeah. Which is very, very rewarding. It really is. The other thing it kind of means is you're getting old, because only old people get these awards.
Right. You're too young. Okay. Are you going to work forever?
Probably, yeah.
Probably.
No, I won't work forever. I really won't, because I don't think I should take a slot forever. Yeah. And I think at some point you need to go out when you're still very productive. I will not be one of these people that linger on and beyond my productivity, I'll tell you that.
Yeah, it's interesting. And you have the place you have a camp up on the Upper Peninsula. You send me pictures once in a while with your cats and all the videos up there.
Yeah.
But
it's my hometown, and I hang out.
Oh, the camp is in your hometown?
Mm-hmm. Yeah, I hang out with people I've known since I was very young. There's still a few of my friends' parents around. Yeah. That I see when I'm up there. Yeah.
Is there any, before we close, I have a few final questions, but is there anything else you'd like to share on anything else the Dairy Digressions community needs to know at this point?
I'd just say that it's very digressive.
It's very digressive. It is. It is very digressive. We certainly appreciate your work. I mean, Pam, you and I like to joke around, but you are known as a very influential science, very influential speaker. You're as humble as could be.
Oh, thank you.
And you were one of the top section editors we always had, and you're always doing that work for us. And so we appreciate that. And again, very sincerely, congratulations on that award. Very well deserved. And now you only have to pay $200 to go to the meeting. Okay.
I just learned that, and I'm so excited about
You're so excited. 2 questions. Did anybody, who was your most influential mentor? You mentioned
Jenks Britt.
And did he give you any advice that you would care to pass on to young people may be listening, or maybe it wasn't really like that, or what was it that he instilled in you that made you
He
think of him as a
He
mentor?
gave me quite a bit of advice. Early on, he just kept telling me I needed to work harder.
Yes. Perfect. Yeah,
Because I needed to outcompete all the guys, is what he told me, basically, at that time. What I think, the advice I give to my mentees and such is you're very fortunate when you can work on something that aligns with your passions and your interest.
for sure, right?
Most people don't get to do that.
Yeah.
And so if you get to do that, that's like the best case scenario where you get to go to work and work on something that you're very interested in. So I really encourage that. The other piece of advice I give to people is a lot of people have balanced lives. And my life hasn't necessarily been balanced as much. So I will tell my mentees, pretty much all of them, that, you've got to figure out how to balance your life the way you want to do it, your home life, and your work life. And I'm not necessarily the role model for you. You have to seek out the right balance for you, where you want to live. I've moved 8 times or something, probably. And that's very disruptive for a family. And, there's people who haven't necessarily benefited from that. As our family, we've benefited overall. But everybody's got to kind of figure out what will work for their trajectory. And it's not the same. And then something that took me a really long time to learn as a mentor of graduate students is not every graduate student wants the same career that I've had. They don't want that. They want something different. And so aligning their careers with what they want. Maybe they want to be primarily a teacher. Maybe they want to primarily do extension. Maybe they want to just do training of people. Figuring out what it is that really brings them a lot of joy and passion, I think, is way more important than knowing everything there is to know about a subject.
I want to just digress very quickly. We're going to wrap up here in just a second, but you mentioned early days and Jenks telling you to work harder and stuff like that. And I remember the old knock on women as veterinarians. They're not big enough, strong enough, whatever enough to do it. You need guy. It's a guy thing. How do you react to those thoughts? Or you must have went through it.
I went through it massively. I mean, we could do a whole digressions on that, but we're not going to. No, I got huge pushback most of the time. Early in my career, it was very difficult to get a job. My first job, it was very difficult to get in. I got paid less than my fellow students that got out. I think people should be allowed to pursue the things they're interested in, regardless of any characteristic. And that's what I tried to do. I tried to just put my head down and do what I wanted to do. And, if I was going to be successful doing it, I'd be successful. If I wasn't, I had a backup plan. If I didn't get into vet school, I was going to go to Cornell and be a dairy nutritionist.
Oh, nice. With Dale Ballman, right?
That was my backup plan.
Right.
I think it's hilarious.
Yeah,
I intended to go and be a dairy nutritionist. And that was my backup plan because I wanted to work on farms with something practical, and dairy nutritionists can go to farm and do that.
Yeah.
And so I just think it's important to find the stuff that you think will bring you, that you're passionate about, and do it, and go out and do that. And that's what I tried to do. And I tried to ignore all the sound that was going on around me, even though I had a lot of self-doubt. I had a huge amount of self-doubt. But I just, I'm very persistent.
Well, I think I would just like to say, you young people, you've paved the way. And it's people like Pam who maybe has made it a little bit easier when you're a female veterinarian trying to start in large animal clinical practice.
I think
and successful people like you have shown that this can happen. You can practice. Let's get over it. So you've already answered my next question. What if you weren't a veterinarian? What would you be doing in dairy nutrition?
I was going to do a PhD in
dairy nutrition. Nothing else. How about outside the animal world?
I didn't have anything outside the animal world that I wanted to do.
Dairy nutrition.
I was going to do dairy nutrition.
You could start over. Well, Pam, it's been fantastic speaking with you. I knew it would be fascinating and enlightening. And so this has been the Dairy Digressions podcast. If you like what you hear, please like and subscribe. If you have a comment, it's adsa@adsa.org. And Pam, thank you very much.
Thanks, Matt. It's always a pleasure to chat with you.
All right. Thank you.